It's my honor to introduce Dr. Mustafa Baskaya, who's a very close friend of mine. We actually trained together for a bit, and he will be talking about cerebrovascular neurosurgery, how to start a practice. Dr. Baskaya is the Robert Dempsey Professor of Neurosurgery at the University of Wisconsin. He's also the director of the skullbase surgery program there, the neuroanatomy and microsurgical skills lab, as well as the cerebrovascular and skullbase fellowship. Dr. Baskaya, look forward to your talk. Thank you.
Thank you, Greg. I'd like to thank the presence of all three societies, organizers, participants. Good morning, good afternoon, good evening, wherever you are. Dr. Morkos gave me a difficult task. I like to talk about the surgery, but I never thought about, I'm going to talk about how to start the practice in cerebrovascular surgery. So I'll try to do my best. Practice patterns may not be the same in every continent and every country. So whatever I say may not apply to your own country, home country. I have no disclosures. And cerebrovascular neurosurgery requires a multidisciplinary team approach. You have to have cerebrovascular neurosurgeons and interventional radiologists or hybrid neurosurgeons or interventional neurologists, stroke neurologists, radiation oncologists. So aim is to design the individualized treatment plans for each patient, not just generalize the treatment plans, and optimize the treatment for each patient's unique needs.